Health officials here in New York City and in Los Angeles are sounding the alarm about a resurgence of the coronavirus. Rising transmission rates in Los Angeles could force a return to an indoor mask mandate. New York City's health department is urging people to wear masks in public indoor settings and around large outdoor gatherings. This comes as cases and hospitalizations are on the rise nationwide. Here to discuss this latest wave is CBS News medical contributor Dr. David Agus. He's in Los Angeles. David, good morning. So it's called BA.5. It's the latest subvariant that everyone seems to be talking about. What can you tell us about the latest wave of infections?
So this BA.5 is by far, and I emphasize by far, the most infectious variant we've seen, and it's what we call immune evasive, which means even if you had Omicron a few weeks ago, you can get this new variant. So the prior exposure doesn't help you, and the vaccines don't help you from getting it. The vaccines help you from serious illness and hospitalization, especially if you have a booster. But this is so infectious. It's spreading throughout the country. Over 90% of places in the country have really high transmission rates. So certainly this is a new wave and a new era in the COVID battle.
And Dr. Agus, as we go, are there added health risks to getting COVID multiple times? Are there greater risks of perhaps long-term illness because of those repeated illnesses?
Yeah, what we're seeing is that every time you get COVID, the chance for long COVID complications, problems in the lung, psychological, neurologic problems, and others go up. And so they build on each other the more you get infected. So certainly now, where a good portion of the country is being exposed to BA.5, we are worried again. And there's a new variant coming, and it's in India. It took over BA.5 literally in several weeks, called BA.2.75. And that will be our next wave here. So we're going to have these successive waves. We have to make sure we keep vaccines and boosters up in this country.
Along those lines, what is the latest in terms of getting a vaccine or booster, I should even say, that is linked directly to BA.5 or even this next variant?
Dana. We will get variant boosters in October. Right now, they're not including BA.4, BA.5. They're the former Omicron variants, which still give us more protection of BA.4 and BA.5 than the original. But right now, it's still too long a cycle when a new variant comes to put it into a booster. We were told it would be 6 months. We're a year out now, and we still don't have them. And so we need to build a better, faster process in the United States to keep rolling out the new boosters.
You know, we've said this before. Is this just our new normal, where we just have to ride this wave of waves?
Yeah, I see that in your eyes. Yes, this is our new normal, and we're going to live with the virus. We have backups. We have monoclonal antibodies, and we have Paxlovid for people that are at high risk, but we have to keep them. We're not doing well at getting those boosters. There are 40,000 hospitalizations now in the United States, and that is way too many. Most are preventable with boosters in these medicines, and we have to use them so we can continue to live with the virus and ride these waves, as you put it.
So I guess the mask is coming back on for good, or at least for now. Dr. David Agus, thank you so much.